Well, speaking of which, those COVID-19 cases are back on the rise, including the flu and RSV, as you just heard. And with the increase, 2 COVID shots were approved from the Food and Drug Administration and Centers for Disease Control and Prevention.
CW39 Houston's Kara Willis is live from a CVS pharmacy now to break down what we need to know about these vaccines. So, Kara, when is the best time to get vaccinated? I know they say by the end of October, but when do you think is the best optimal time to prevent infection?
Well, Ito, you're slightly right. The CDC actually says that you can start getting your vaccinations now. Between September and October, that is the best time to go ahead and get those vaccinations against those 3 illnesses. And joining me this morning at CVS Health, I have Aisha here. She's going to come into the shot with me here. We're going to break down what this all looks like and what we need to know about the new COVID-19 vaccine, who's at risk, everything you need to know to make sure that you and your family stays healthy. So let's go ahead and start talking about, well, first off, good morning. Thanks for being up bright and early. Let's go ahead and talk about the new vaccine. What are the main things we need to know about it? What makes it so different than maybe the others in the past?
Yeah, so definitely want to emphasize that the new COVID vaccine, it's new. It's not a booster, so it actually is more targeted towards the current strains that are rotating and going to protect you much better than the old vaccines.
What are the symptoms? Are they about the same?
Yeah, very similar symptoms. You may have a little bit of headache, mild chills, injection or injection at the numbness at the injection site, but very similar, nothing that can't, is not as severe as getting the actual flu or COVID.
Okay, we're going to move this way just a little bit. There we go. Go ahead and tell us a little bit about how early you can start getting the vaccine.
Right now, we have them in stock, readily available. You can make an appointment easily online or walk in, and you'll be greeted by a pharmacist ready to serve you.
And with that, who's the most at risk?
Your most vulnerable population will be your 60 plus. Those are the people that are a little bit more immunocompromised.
And is that with COVID-19, RSV, and the flu?
Yes, ma'am. And the RSV vaccine is specifically for only 60 plus.
Okay, and you can start getting all 3 of those vaccinations, is that right?
Yes, we highly recommend getting all 3 in the same visit. That way you're protected and geared up against this vaccine season.
Okay, and big question I hear from a lot of people, there are a lot of myths out there. Do you want to mention what are some of the most common you hear about?
Yeah, I will say a lot of people feel they can get the flu from the flu vaccine, and that's not true. The vaccine is inactivated, so you're not going to be able to get it from the flu vaccine. It's just there to protect you.
And as far as COVID-19, you hear any big ones?
Not yet. We'll see what comes out.
Okay, what has been the response so far when it comes to the new vaccine?
So a lot of people don't know about it yet, so that's why it's really great that we're here talking about it. But once we tell them about it, they are excited, especially once we explain the difference between what's new and what's old.
Okay, and do you have a rough estimate of how many you guys have vaccinated here at CVS Health so far?
Yeah, so since the beginning of the pandemic, we have probably protected 88 million lives, which is really just exciting.
Okay, and so education is key in all of this. And again, those appointments are available. Go ahead and give us the website of where we can book an appointment.
Yep, cvs.com, and also you can always walk in as well, and we'll take care of you.
Okay, awesome. Thank you so much for all the helpful information for everyone out there that wants to get vaccinated. Guys, we'll have more information on our website at cw39.com, but guys, I'm going to send it over to you.
Yeah, great interview there, Kara. Thank you so much. Information to protect our families and each other. Always.